As we're nearing the end of 2024, there's been a lot of change that we've seen throughout the year. And so I'd like to do a recap briefly on some of the things that we've seen in the marketplace impacting the self-funded health plans that we help employers build. And also to take a look at what we might see hitting the plans in 2025 and beyond. The first thing I'd like to highlight and the biggest changes that we've seen in 2024 is with regards to prescription drug costs. This is ground zero for plans because ultimately prescription drugs are commodities, and if we can acquire them in a more cost-effective way, it's better for the plan and it's better for plan participants. Many of the strategies we've been using to acquire these drugs as cost-effectively as possible changed. The elimination or evaporation of these patient assistance programs through pharmaceutical manufacturers and our ability to get drugs at low cost or no cost through that source. So we've seen more and more employers adopt the international sourcing route to contain the cost of drugs, both for their plan and for their employees. If employees are open to receiving their drugs or obtaining their drugs through pharmacies in Canada, for example, more and more employers are showing a willingness to help employees do so. But certainly that's not a decision to be taken lightly. In addition to more routine medications, even like GLP-1s, the cost of specialty medications, drugs that are infused, are hammering plans. It's common to see $100,000, $150,000 prescription drug bills for one drug for one plan. And if you're an experience-rated, fully insured plan and you have one or two of those medications, you can expect to see massive increases year over year because of the impact of these on your plan. On the medical side of the plan, when prescription drugs are being handled in a hospital setting, for example, there's resistance to the term white bagging, where the plan acquires the drug at a low cost, provides it to the hospital to infuse to patients. Hospitals don't like this process for many different reasons, and they're getting more and more resistant to that technique to containing costs. So we've had to pivot and use other strategies to get these highly expensive infused medications as cost effectively as possible. In addition to prescription drug changes this year, there's been a number of other things that we've seen. We're back to the standard practice of double-digit increases for fully insured plans. We track every fully insured increase we've seen throughout the year, and the average increase we're seeing is 20%. The highest we saw was 49%, and the lowest was in the high single digits. We don't think this trend is going to change anytime soon. So from a fully insured perspective, employers need to start contemplating what are their alternatives when they get double-digit increases year over year. We're back to what we saw in the late 2010s. Prescription drug costs are a huge component of what's driving these fully insured renewals. Blue Cross Blue Shield of Michigan had covered GLP-1 medications for weight loss specifically, and starting in 25, they won't be. Priority Health hasn't already. More and more employers are really struggling with, do we cover these weight loss medications in 25 and beyond? The jury's still out, but the price is hitting the bottom line significantly. So more employers are starting to consider creative solutions or different solutions that weren't on the table for them in the past. Number one is considering self-funding. Self-funding still is coming down market in terms of employer size. So employers of 30, 40, 50 employees are really seeing self-funding as a viable option. In addition, we're starting to see employers really debate, do they continue to offer group coverage at all or not? Do they drop it altogether and shift their employees to the marketplace? That's a tough decision to make, but the numbers are starting to force that for some employers. We've also seen employers drop insurance and use a cost-sharing strategy, maybe a faith-based one or a non-faith-based cost-sharing strategy, which has a lot of risk in and of itself as well, but the math is pretty compelling for employers to consider, and they might be willing to tolerate the significant downside of these cost-sharing strategies as well. The final trend that we've seen in 24 and that we think is going to continue and accelerate in 25 and beyond is both plan participants and plan sponsors are more cognizant of what health insurance actually costs and starting to ask questions. We've seen some proposed class action lawsuits against Johnson & Johnson for the way that they were managing their pharmacy benefit for their employer-sponsored health plan. Wells Fargo saw a similar initiative. We've also seen more employers being willing to sue insurance carriers for the way they're managing the plan and some of the obscene fees, in our opinion, that they built onto both fully insured and self-funded plans. So we're expecting to see increased litigation, both from plan participants and plan sponsors, and more folks starting to ask the question, why? As we see double-digit increases become the norm, which I believe is going to be the case for the next couple of years, we're going to see more and more people wanting to get some serious answers, and we anticipate that more and more employers are going to need to consider alternatives in 2025 and beyond.